Hi, Ms. Genzier. My name is Kyla. I'm a student occupational therapist at the University of St. Augustine. How are you today?
Good.
Good. All right. So your doctor's ordered an OT evaluation today so we can address the symptoms that are keeping you from doing the things that you want and need to do. I understand that you suffered a stroke during your coronary bypass surgery about 7 days ago. Is that correct?
Yes.
Yes. Okay. And that left you with a left upper extremity hemiparesis. Okay. Can you move your left shoulder, arm, hand, anything like that? No. Okay. And how are you feeling today? Do you have any pain?
No.
No. Okay. And on a scale of 1 to 10, 1 being you feel great, 10 feeling like you need to call the ER, how would you rate yourself or rate your pain today?
I think about a 4.
About a 4. Okay. And what seems to be bothering you? Is it from your surgery or is it your arm or?
I think just from the surgery.
The surgery, so your chest is hurting?
Yeah.
Okay. And do you know where you are today?
Yes, I'm in a hospital.
In a hospital, okay. Yes, you are in an acute care hospital in St. Augustine, Florida. Okay, and can you tell me why you're here?
I'm here because of my coronary bypass surgery and the stroke I had.
Okay, very good. And do you know what month it is?
It is December.
December, very good. All right, and when is your birthday?
It's June 25th.
June 25th. All right, and what year?
91.
91. All right, so you're pretty young. Okay. So I see from your chart that you have sternal precautions due to your incision in your chest from your coronary bypass surgery. And it looks like you have no past medical history. Is that correct?
Mm-hmm.
All right. Yeah, you're very young, so that's good that you don't have any other history. And who do you live with at home?
I live with my husband.
Your husband. Okay. And does he work, or is he at home? Does he work from home?
He works.
He works,
Mm-hmm.
okay. So whenever you go home, who's going to be there to take care of you?
He's going to take a leave of absence, so he'll be there all the time.
Oh, okay, so he's going to be there during the day and at night?
Yes.
Okay, and he's willing to take care of you?
Mm-hmm.
Okay, very good. And is your home a one-story home, two-story home, condo?
It's just a 1-story.
One-story, perfect. All right, and are there any steps leading into your home?
There's just 2 steps.
2 steps, okay, just to get into the front door? All right, so if there are steps, are there any handrails?
Yes.
Yes, okay. Good sturdy handrail?
Yep.
Okay. And so I'm assuming that your bedroom and everything that's on the first floor then. Do you have a bathtub or a shower? You have both. Okay, very good. So is there what's your shower like?
It's just a walk-in.
Walk-in
There's a
shower.
little ledge.
Oh, okay, very good. So is it just like a ledge to keep the water out?
Mm-hmm.
Okay. And do you have any grab bars in your shower?
I do.
You do. Okay, great. Do you have like a shower chair or anything like that?
No.
No. Okay. And prior to your stroke, were you driving?
Mm-hmm.
Okay. Good. And have you ever fallen before?
No.
No. Okay. And so I mentioned earlier that you have sternal precautions. Are you able to repeat those to me?
Yes. I cannot lift more than 8 pounds.
Okay.
I can't drive again until I'm given the approval.
Right.
I can't push or pull anything, reach above my head, or reach behind my back.
Perfect. All right. So yeah, really those are just to keep you from opening up your incision. So just anything that you feel like might be tight in your chest, stay away from any of that. Do you wear glasses or contacts?
No.
No. Okay, perfect vision. So you can see okay?
Mm-hmm.
Okay. Can you see that clock over there?
Yes.
All right. What time is it?
It's 6:30.
6:30. Perfect. All right. Now I'm going to do a little vision test with you. Can you follow my finger? Don't move your head. Just follow my finger, okay? Good. Okay. So here's a silly question for you. If there was a fire in your room right now, what would you do?
I would call 911.
Yes, exactly. All right, now I'm going to ask you a series of questions related to your home life. So just about like a typical day with you and your husband. All right, so who does the grocery shopping at home?
We both do.
You both do, okay. One more than another, or?
I think I usually do a bit more.
Okay. Would he be willing to grocery shop if you needed to?
I think so.
Okay. And who does the majority of the cleaning, cooking, laundry?
That would be me.
You do, okay. And would he be willing to do any of that too while you're
I would hope so.
cooking? Okay. And who's responsible for the household finances?
My husband is.
Okay. So the next thing I typically do is manual muscle testing, but because of your current condition, I'm not going to do that. That's a little inappropriate for right now. But I am going to do some functional range of motion with you. So what I'm going to do is I'm going to assist you from sitting here. We're going to move to the edge of the bed, and I'm going to ask you to perform a few different movements for me. But I understand that some of them will be difficult because you can't use your left arm, but don't get discouraged. It's okay. It's normal, okay? So, all right, is what I want you to do is I'm going to have you use your right arm to scoot yourself forward, and then we're going to sit on the edge of the bed, okay? All right. Good. Good. And how are you feeling?
Good.
Good. Okay. So, are you able to shrug your shoulders for me? Okay. Do you feel any pain with that?
No.
Okay. Can you bring your arms up like this for me? Good. Okay. Can you bring this arm up at all?
No.
Okay. And can you bend your elbows for me, like you're going to do a bicep curl? All right. And can you turn your wrists? Good. And still nothing on that one? Okay. Now I want you to squeeze my fingers as high as you can. Good. And what about this one? All right, just a little bit. All right. Are you able to do this with either of your hands? Good. And can you shake my hand? All right. And what about with this one? All right, a little tiny grip there. All right. So now what I'm going to have you do is we're going to do these individually, but I'm going to have you extend your leg, and then I'm going to have you point your foot, and then flex your foot. Could you do that with your right leg for me? Good. And bring it back. Yep. And can you do that with the other leg?
Yes.
Good. And you're not feeling any pain with any of this?
No.
All right. Any dizziness, shortness of breath? No. All right. So it looks like you have great lower extremity mobility. Now what I'm going to do is I'm going to stand you up. I'm going to see if you're able to do that.
Okay.
And then we'll sit back down. Okay, so you feel all right?
Mm-hmm.
All right. So that's what I'm going to do. So I'm just going to grab onto your gait belt. On the count of 3, we're going to rock forward. And we're going to stand you up, okay?
Okay.
1, 2, and 3. Good. Okay, how do you feel?
Good.
Good. Okay, no dizziness or anything? All right. So now I'll sit you back down, and then I'm going to actually have you get back up again, and we're going to do another activity, okay? So if you want to bring your right hand back to the edge of the bed, and we'll slowly lower you down. Good. All right, you feeling okay?
Yep.
Good. Okay, so we're going to have you stand up one more time, and then I'm going to have you march in place once you're standing up, okay? All right, so we'll do the same thing on the count of 3. 1, 2, and 3. Good. Okay, now if you could march in place for me. And how are you feeling?
Fine.
All right, and go ahead and sit back down. Reach back with your right hand. Slowly lower yourself. Good. Okay. All right. So, before I leave today, I want to ask you a couple questions. Are you okay sitting like this, or do you want to lay back down? Okay, it's good to get you up and moving a little bit. So I want to ask you a couple questions. What are 3 main goals that you want to achieve before going home? Like, what are your activities, or
I'd like to be able to take a shower,
take a shower? Okay.
maybe walk around
Okay.
without feeling uneasy.
All right. What about like getting back to work?
And then,
Where do Great. So you want to make sure you can take a shower by yourself, walk, and get back to work, okay? Can you show me how you wash your hair right now?
Probably
Just one hand, okay? Can you reach to the other side of your head? Okay, good. All right, so we'll be working with you to increase your strength, mobility, and endurance on your left side. That way we can get back to showering, walking, and work. So I understand the stroke has made it difficult for you to grasp things. You're a little shaky. You're often pretty tired. But we're going to be here for you to work on all of those things. And also, I'm going to leave you with some homework. I'm going to leave you with a ball. Let me grab that for you. And it's what I want you to do is whenever you're just laying in bed watching TV or something like that, I want you to take the ball and I want you to just try to squeeze it with your left hand.
Okay.
Just open and close. Now you're probably not going to be able to do that just with your left hand, but you can use your other hand for assistance, okay? And this is just to get the muscle memory working and try to activate those the muscles again in your arm, okay? So here's this for you. So we'll practice a little bit. Can you try to squeeze that? All right, so then you can take this hand and you can try to close your fingers, okay? So try to close that. Good. All right, so I'll leave that on your table over here for you. And just, like I said, you don't have to do it all day long, but maybe a couple times a day when you're watching TV or something.
Okay.
And I'm also going to ask your nurse, whenever she comes in, to bring you your meals or anything like that and to give you your medications. I'm going to ask her to deliver everything on the left side. That way we can activate that side, and I'll have you reach for your medications with the left hand. And it's going to be difficult, but don't think that you're not going to get your medication because you can't grab it with your left hand. And also, whenever I come in to talk to you, when I do stuff with you, I'm also going to stand on that side just to get it activated, turn your head that way and whatnot. And then also, before you're discharged, we're going to talk about the need for any assistive devices. So things such as a sock aid or maybe a shower chair. It looks like you're doing great with your right arm. You're very young, mobile, everything. But you might need like a shower chair. I think that would be helpful until you're fully recovered. And then we'll also discuss whether you should go to an outpatient therapy center before going home, depending on how much recovery we see here with OT. Okay. And then lastly, because you're so young, I do want to mention that we do have support groups for young adults who have suffered from a stroke. I know this is very hard to handle, so I can provide you with resources for that if you'd like them, okay? Do you have any questions for me?
Yeah.
All right. So I'm going to be in about 3 to 4 times per week with you, and we will be working on getting you back to work. We will be working getting you walking and showering and build the strength up in your left arm, okay? So I'm going to lay you back down, and if you don't have any other questions, I think we're good, and I'll see you tomorrow.
Okay.
All right, so I'm going to ask you to lean back with this arm, and we're going to slowly lower you back down. Did you want to sit up or lay down?
I'll probably just sit up.
Okay, good. Very good. And we'll just prop this back up. All right, it was nice meeting you, and I'll see you tomorrow.
Okay.